Thank you all for joining us. Welcome to our webinar, The Intersection of Environmental Justice and Healthy Communities. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the 8th in our 2023 Climate Justice webinar series as part of the Climate and Health Equity Fellowship Program. Known as CHEF, the CHEF program recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Climate and Health Equity Fellowship Director. Also joining me from the consortium to run this webinar is Program Assistant Clarissa Patent. Clarissa will be available through the chat to answer any technical questions during the webinar. Our other team members on the webinar are Dr. Kimberly Williams, Program Manager, Dr. Venice Curry, the Western Associate Director, and Jordan Curry Carter, Program Manager. The webinar series is hosted by the Medical Society Consortium on Climate and Health. It is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern Time. Today's webinar will be recorded and made available on our website for future viewing as part of the Equity Resources page on the Consortium's website. This year, we are pleased to offer CME credit for our webinars. Instructions on obtaining credit will be provided at the end of this webinar. Today, we are really honored to have Dr. Mustafa Santiago Ali, Vice President of Environmental Justice, Climate, and Community Revitalization for the National Wildlife Federation. And rather than using our time to provide further description of his impressive work, we are placing links to his bio in the chat. As a healthcare provider, it is important to consider the role that healthcare systems and providers play in regard to climate and health. In this webinar, Dr. Mustafa Santiago Ali will discuss the issues and progress made toward achieving an equitable and sustainable future in low wealth and communities of color, including his work elevating environmental justice issues and implementing holistic strategies to address the issues facing vulnerable communities. The format for today's webinar will be a 40-minute presentation by our speaker, followed by 10 to 15 minutes of questions and answers from our audience. We ask that you please put comments, links to any resources that you may recommend, or any questions that you may have for the presenter in the chat box at any time during this presentation. We will get to as many of the questions as we can during the Q&A period. Also, please keep yourself muted so we are not interrupted by background noise. Now, Dr. Mustafa Ali, please do begin, and thank you for joining us.
Well, thank you for having me. I really appreciate it. It's good to see so many pictures of so many amazing folks. I apologize for the technical issues. Luckily, I have an amazing person who's standing right next to me now, getting me ready to rock and roll. So as soon as we are able to screen share, we will get moving. So thank you again for wanting to talk about climate justice, environmental justice, the health of our communities, and making positive change happen. Thank you all so much for everything that you continue to do every day to make that become a reality. And we'll go start through here. So I wanted to, can everybody see the presentation? Everybody can, great.
Yes.
All right. Well, Mahatma Gandhi said it best when was talking about the intersection of so many different issues, but especially when we talk about the planet that we live on, when he shared that the earth provides enough to satisfy every man and woman's needs, but not enough for every person's greeds. And that's what we find is that often when we're not focused on our other brothers and sisters and family, that we get ourselves in trouble. We've seen that throughout the time in our country and across this planet. But we also know that there are some things that have been put in place that actually have gotten us to this moment when we talk about environmental injustice. Everything from the Trail of Tears, where policy said that you could actually remove Indigenous brothers and sisters from their traditional lands, take them away from their traditional foods. Also, of course, we're all very aware of going to Africa, enslaving folks and bringing them to this country to be able to do work. All of that is tied both to environmental justice and climate justice, and I'll talk a little bit about that. But it's also our Chinese brothers who came to this country and actually helped to build our infrastructure. There's so many conversations around infrastructure, both non-existent infrastructure, crumbling infrastructure, and the impacts that happen to communities. And of course, when we talk about the railroads and the movement of goods, the Chinese folks played a big role there. And then policy also said that we could intern Japanese brothers and sisters during the world wars that we participated in. And at the same time, wanted to take away people's rights to be able to live healthy and sustainable. I bring this slide into our conversation today because I want to make sure that we also understand some of the things that have happened, and many of you are aware, of course, in our health fields that had significant impacts. And we often don't talk about the hospitals and the clinics that refuse to, to provide the needed services for folks of color, especially African Americans, and the divide that was built there through segregation. But it was put in place because of laws and policies. And I often talk about laws and policies can be destructive. They can dismantle communities, but at the same time, when focused in the right direction, they can help to heal and they can help to build up. A part of those policies, of course, have been the various sterilizations and reasons why many communities of color sometimes don't trust at the level that we would hope that they would in the medical field. And those sterilizations were everyone, as many of you are aware, from African-American women to Puerto Rican women to Indigenous women and a number of other groups that were a part of that. And I was also, as I was thinking about our conversation today, I thought I would even bring in some of the trusted organizations like the Red Cross and some of the things that were a part of policy in the past around people wouldn't accept blood from African Americans. And the dynamics that played out there and the work that had to happen for us to be able to move forward in a positive direction. And we know that there are always those men and women and family of good conscience that are willing to stand up and push. And this is just a slide from one of the medical committees that folks were pushing to get rid of some of these injustices that were happening through the Jim Crow laws that were in place. And unfortunately, that infected those of us who have worked in the public health realm, in the medical realm. I always want to bring in this conversation also because when we talk about policies and the impacts, we have to go back to sort of the basics that we operate from, whether it is a Declaration of Independence, when we often say all men and women are created equal, endowed with certain unalienable rights, life, liberty, and the pursuit of happiness. All of you are focused on making sure that life is protected, that we're doing everything that we possibly can to make sure that we are improving it and lengthening it. And I always go back to those original documents when folks will say, well, why are we focusing so much on our most vulnerable communities? Well, we put the words down on paper. Of course, we all understand that everyone wasn't seen equally when those were first developed, but we stand on those now. And it is a part of the justification of why we need to do the work. And then, of course, all of you have taken the Hippocratic Oath. And of course, there is a more modern version of it. But I also think back to how we are focused on to do no harm, and making that become a reality should be a part of the way that we move forward. I want to bring into our conversation now also just when I talk about some of the troubling actions of the past, and we will begin to move past these things, just, how literally words were written that, caused segregation to happen. We also understand that during that segregation, that all hospitals, all clinics were not created equal because they didn't receive the same level of funding. And thankfully, through the Civil Rights Act and a number of other sets of actions after that, We're finally beginning to move in a place where there's some parity. But we also understand some of the challenges that folks face. And I want to tie that into the impacts that are happening in our most vulnerable communities, environmental justice communities, and those who are also being impacted by the climate crisis. But history is important for us to continue to make sure that we are remembering it and addressing it. When we're talking about environmental injustice, we also have to bring into our conversation around restrictive covenances and redlining and how that has often pushed people into sacrifice zones. The literal language that's there on the pieces of paper for us to go back and look at and still see remnants of it today continue to play out and many of the impacts that are happening inside of our most vulnerable communities. But I'm also an optimist, for those of you who know me, and I believe that we can make change happen. Many of us, would not be dedicating our lives in the fields that we have been if we didn't believe that we could be a part of positive change. Margaret Mead said it well when she said that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I also bring forward of when we see those injustices that were built into policy before, how when people come together, that we can make real change happen, whether it's the women's suffrage movement. And yes, we know we still got a long way to go to make sure that women in our country have all the rights, addressing the pay gaps that exist and a number of other dynamics. But when folks come together, we can begin that journey of making change happen. Of course, the civil rights movement in the exact same context of folks coming together and saying no more in our country. And then for the environmental impacts that are happening, I bring these two into our conversation because it was young people that really played a critical role in the early environmental work. When we talk about the Clean Air Act and the Clean Water Act and RCRA and a number of these different pieces of law that are the safety net, young people, along with other partners, were driving that agenda. And if you look on the right-hand side, those are young students in Warren County, North Carolina. They were willing to actually lay their bodies down to stop these trucks from coming into the community that were carrying PCBs. And many of you understand that PCBs are carcinogenic and the impacts that can happen. But once again, folks were willing to not just talk about change, but to actually get engaged in the process and to push to make sure that it happened. If you have ever seen me speak before live, I always talk about my mother and my grandmother, who are the rocks that I stand on, and I would be remiss if I did not bring a number of the amazing environmental justice and climate justice leaders. And many folks don't tell you that it is a matriarchal-led movement, and I just want to give honor to all these amazing women who continue to protect lives and to make positive change happen. And why do we do this work? In many instances, we're doing this work for the next generation, making sure that they don't have to deal with the similar sets of challenges that so many folks have. When we talk about environmental injustice, we are talking about the impacts that are happening to African-American communities, Latinx communities, to Asian and Pacific Islanders, to Indigenous brothers and sisters, and lower wealth communities that in some instances happen to be white as well. So there is a need to make sure that all of these communities are protected. And now we are also learning that immigrant communities in many instances now are also being pushed, of course, to the margins and are dealing with a lot of the various types of pollution that is impacting their health. Now, I'm a Baldwinite, and I love when James Baldwin once said that if I love you, I have to make you conscious of the things you don't see. If we're going to have real talk, and y'all shouldn't have asked me to come if we're not going to have real talk, we know that in many instances, our communities have been unseen and unheard. When resource distribution is happening, all of a sudden we become invisible. When the health impacts that are happening, in many instances, we seem to have been invisible to those who often were in power. In rural communities, we often also know that there needs to be a spotlight placed upon the injustices that are happening so that we can move in a positive direction. So I don't think anybody could have said it better than James Baldwin did when he said that if I love you, I have to make you conscious of the things you don't see. Now, many folks don't really understand the depth of the impacts that are happening in vulnerable communities and actually how many folks are losing their lives. If I was there with you in person, I would ask you to take your phones out and to Google the things not only that I say, but when others speak as well. Harvard released a study a couple of years ago that shared with us that over 350,000 people are dying prematurely from the burning of fossil fuels. And if you ask the average person on the street or someone who comes into your office or to the clinic or to the hospital, if they have any inkling of why so many folks are dealing with breathing difficulties and a number of other diseases, in some instances, it's tied back to this number, and we will unpack what that actually looks like. Now, we know that we have somewhere, the number moves a little bit year from year, between 24 and 25 million folks who have asthma. I would ask you all just to think real quickly if you know somebody in your family, whether it's your children or grandchildren, aunt or uncle, nieces or nephews, or just friends who have asthma. We know that that is a serious problem. We know how it plays out. We also know that when it comes to African-American communities and Latinx communities, they're the ones in many instances who are using the emergency rooms and the ones who are unfortunately losing their lives prematurely. So we have some work still to do to make sure, one, that folks have access to the healthcare they need because we understand these impacts that are happening, and helping to continue to educate folks as well. We have 7 million kids. We just talked a little bit about that. And, you know, PM 2.5 and some of the other impacts that are happening in this space continue to be exacerbated because of where people are living, and the exposures that are there, and then also the climate crisis, which I'll get into here in one quick moment. Dr. King said, our lives begin to end the day we become silent about the things that matter. And that's the reason that we, one, have to get educated, but two, that we have to continue to make sure that we are advocating and pushing for the resources that are necessary and for the change that's necessary. I wanted to bring this into our conversation. I just recently was working with some folks who were dealing with this particular situation. And air pollution has some really interesting dynamics that are going on. There are new studies that continue to come out almost on a monthly basis that's continuing to expand our knowledge on the depth of the impacts that are going on. Everything from the black carbon, which you'll see there on the left side, and how it is impacting, babies as they are developing, and a number of other challenges that we have a responsibility to help our community to understand that when you are breathing in, when you are exposed to these teeny tiny particles, how it can pass through your lungs into the blood, and then of course making it, whether it is into the bloodstream or the placenta, and the disproportionality for Black and brown communities. And I just wanted to bring this one in also because the heat that's being created from the climate crisis is also placing additional stressors on moms-to-be and to new babies. So we continue to have double and triple whammies inside of our community. This is the 48217. I wish I could see folks raise your hand if anybody's ever been to Michigan. And then if anybody's ever been to Detroit. And then, of course, how many folks have ever been to the 48217? The 48217 is the most polluted zip code in the state of Michigan. I grew up in two places, in Appalachia and in Michigan, so I know this zip code very well. Unfortunately, when kids look out the window in the 48217, instead of seeing trees and green space, they see the flaring that's happening in facilities there, and the sets of exposures that they're dealing with. It makes it more difficult for kids to be able to learn. It causes, as we all know, a number of various problems. And we can do better than this. Sometimes folks will think, well, this is just an urban problem. I bring this set of information into our conversation today because it is an urban problem, but it is also a rural problem, and it is also a problem that reaches all the way to our national and state parks. And we found that there is a significant increase in air pollution and smog, in our national parks. And our national parks often are the place that people will go to get away, to be able to recharge and reconnect. And we're finding that both the air pollution and the climate related challenges are increasing in these locations that were supposed to be a refuge for us. I figured some folks have been to Houston. I wanted to bring the Manchester community into our conversation because the Manchester community is a hardworking Latinx community. And as you can see here, this is Cesar Chavez High School. And you have athletic activities that are going on. And if you look in that background, you'll see the flaring that's happened there. So I'd ask you all just to think about when you were in high school, or even before then, if you had to breathe in this type of toxic pollution on a regular basis, would you be able to be sitting in the seats that you've been blessed to sit in right now? And that's the dynamic that's going on. The other thing about the Manchester community, and I should have added an additional photo for you, when you go to this community, you can literally stand in people's backyards or front yards in some instances and reach your arm out as far as your fingertips can go. And the folks in that community can literally touch the fencing of the petrochemical corporations that are there. So you can only imagine the sets of exposures that they are dealing with, being in such close proximity to all these various types of things that are going on. So I thought, since I'm talking to some docs today, you might find some appreciation for seeing the sets of exposures that folks are dealing with. Everything from vinyl chloride. Many people became associated with vinyl chloride and a number of other chemicals when we had the train derailment in Ohio. So then people began to garner more interest in what was going on there. You have hydrogen cyanide that's there, you have mercury, you have lead, and a number of other very toxic chemicals that folks are dealing with. This is a walking path that's there, and you can see how close it is to that facility. And literally, it's almost like Cancer Alley. As far as you can see along the ship channel there in Houston, you'll see communities that are literally right up against. And then I'll just bring into our conversation, I'm going to talk a little bit about climate here in a bit, but when the hurricane came through, there was flooding that happened. So one, you had huge amounts of emissions that were pushed out because folks were going through something called startup shutdown. So when there's a major storm that's coming through, they just push all this out so they can shut down the plant until the storm passes. The other dynamic was then huge amounts of flood water washed through this community. And it impacted the Superfund sites that were there. Superfund sites, for those of you who may not be, who may not know a whole lot about that, are our most toxic sites across the country. Some of the most deadly toxins are there. And we have a process for making sure that the cleanups happen. They often take quite a while to get in place. This is the diesel death zone. This is in Wilmington, California. And the reason that it's called the diesel death zone is two reasons. One, as you can see in these pictures, and you see folks out trying to enjoy their weekends and the games that are there, the soccer matches, families just, being out in the park that's there. You have huge amounts of traffic that's there. So there's just this unimaginable amount of trucks that continue to pass through. They're going to these facilities. And then, of course, you have the facilities that are in the background. And you have incredible rates of both asthma, you have incredible rates of cancer, liver and kidney diseases, and a number of other things that folks have been exposed to. And I want us to think about this. This is in California. California, a place that is supposed to have some of the most progressive laws. And it shows you the amount of work that we still have to do. And of course, in some instances, what's coming out, these emissions that are coming out of these various plants is also playing a role in the warming up of our oceans and of our planet, and making the climate crisis and these climate emergencies more intense. I've wanted to bring into our conversation also just a little bit of the water quality and water pollution impacts that are going on. All of you are very familiar with what happened in Flint, Michigan. That's little Miss Flint. She's a little older now and continues to do advocacy work in this space. I've worked on many of the natural disasters and man-made disasters. Of course, this is one of the man-made disasters. And then, of course, Jackson, water crisis. There's a water crisis that was going on in Benton Harbor, Michigan, in East Baltimore. There are so many places across our country that is dealing with these impacts of lead. And you all are experts on understanding that when lead impacts a child or a baby, the neurological problems that are associated with that, along with another of other health impacts that are tied into that space. The beauty of this moment is that there's an administration right now that is swapping out many of those lead pipes. Michael Regan, who is the administrator of the Environmental Protection Agency, has been very, very focused on helping to do everything that's possible to at least eliminate this one part of the lead crisis that we have going on. There are a few other ways that we're having these issues in relationship to lead poisoning. And then I don't know if you all know Catherine Coleman Flowers, but she wrote this amazing book called Waste. Because when we look in places like Appalachia, when we look at many of the reservations, when we look at the Black Belt, there is a lack of wastewater infrastructure. And of course, there are a number of diseases that are associated with the exposures from the pathogens that are often in that water, and the work that needs to happen. And the infrastructure, we've got to get that in place, because we understand as temperatures continue to increase, that many of those pathogens and new ones will be able to find, unfortunately, fertile ground to continue to grow and to impact people. And then, of course, a lot of the water runoff that's happening right now is killing both wildlife, making folks sick, and is just creating this toxic soup that is going to make incredible sets of difficulties as we move forward. I wanted to bring into our conversation also around the food desert issue, because when we see folks who are dealing with challenged immune systems, when we see folks who are trying to fight off these sets of exposures that are going on, and then they don't have access to healthy food, it makes it extremely difficult. As you all know, you all are experts in the space. And so we have that dynamic that's happening also in relationship to environmental injustice. And then because of the climate crisis, it makes it even more difficult for places where folks were able to grow food to continue to be able to do that. So once again, we've got the double and triple whammies that are happening. We also have the pipelines. We have 2.4 million miles. That says 2.6 million miles. Actually, some of it's been shut down now, a fossil fuel pipeline. So when we look at those previous scenes, whether it's Cancer Alley, or if it's what's happening in the Manchester community, or if it's happening in some of the other locations like Institute, West Virginia, you know, they're carrying these sets of chemicals that are putting these stressors on people. And we have enough fossil fuel pipeline that we should never have to build anymore. We've got enough fossil fuel pipeline to go to the moon and back around 5 or 6 times. And that's just in the United States of America. And you continue to see folks advocating for building more, and you continue to see communities pushing back and saying, we've already suffered enough. I wanted to bring into our conversation also, because as we begin to move down the road in this new clean economy, we're going to have some sets of exposures that will happen because of the mining of critical minerals, just like we had with the mining of fossil fuels, both in this country and outside of the country. And it is just a field that we just have to pay attention to. We have to make sure that we're strengthening our laws to make sure that we are minimizing the sets of exposures that folks will have to deal with. And as much as there is in relationship to challenges, there continues to be folks who are willing to step up. And I had to bring our sister Beyonce into the conversation, because when hurricanes came through, she made sure that there folks who were there had food and clothing, and used her platform to bring attention to the sets of impacts that were happening. And there are a number of folks who are in sort of the cultural influencer space, who help to make sure that we are putting a spotlight on what needs to be shared. And then, of course, there's these additional sets of impacts that come in now because we have more intense hurricanes, we have the floods, literally biblical floods in many locations, and sets of exposures. The things that are in the water then move, and of course, additional pathogens and pests and a number of other things that folks have to find ways of dealing with. We know that we've got West Nile, we've got a number of tropical diseases that are now moving because of these increased temperatures in the southern part of our country, and it will eventually move further north. These are just some of the events that you've seen, and I always have to think about our most vulnerable communities who often don't have a way to escape, and often find it even more difficult to be able to come back home. I worked Katrina a number of years ago. There's still folks who struggle to be able to come back home, and many times we'll go back, 2-3 years after one of these major events happens, and folks have still had difficulty. Folks will still have the blue tarps on their house. In many instances, clinics that once were near a community didn't have the ability to be able to bounce back. And so we see all these different dynamics that just continue to place these additional stressors. We see stressors also from, once again, our most vulnerable. So these are farm workers in the fields when the wildfires were going on in California. So if you look at the photo on the left where the workers are there still picking, in many instances, they just, I've seen this up close before, so you just got to give me a second. It is unimaginable that folks would be held in position when this type of a natural disaster is going on. The amount of smoke that they're breathing in it's criminal. And then afterwards, the lack of access to healthcare for the exposures that folks are dealing with is something that we have to continue to work on. I'll talk a little bit about that here in a second. And tying into the last slide and some of the conversations just a couple seconds ago, we have to make sure that we're addressing the healthcare gaps that exist. We have medical deserts, healthcare deserts. We have a need to really focus on our health professionals and make sure that we are doing everything that we can to, one, make sure that folks have the training that's necessary in environmental medicine and in the traditional forms that folks are trained on, and being able to be supported to be able to practice in and near our most vulnerable communities. And that is a part of the evolution that many folks are working on. And when we don't have that, it makes it extremely difficult. So for folks to be able to get to healthcare, if it's too far away, but also in many instances, folks are dealing with some really challenging situations. And if they don't have that access, and if it's not affordable, it just creates these barriers where in many instances, folks will just allow things to get to the level where it's hard for them to ever come back from it. So climate change affects everyone, even though some folks would like to believe that it doesn't. I just wanted to share with you all some of the actions that have happened over the last few years that have been playing a role in really helping us to be able to move forward. So you have the executive order that President Biden signed on tackling the climate crisis at home and abroad, really getting federal agencies to all understand their responsibility in this space. You have the White House Environmental Justice Advisory Council that has various leaders from frontline organizations and others who help to provide advice and recommendation to the president. There's never been a White House Environmental Justice Advisory Council before. There was a National Environmental Justice Advisory Council that EPA used to lead and still does, but this elevates environmental justice and climate justice to the highest levels in our government for the first time ever. We also have the Justice 40 initiative. So that initiative, for those of you who are not familiar with it, says that 40% of the resources have to be focused on our most vulnerable communities. When I first started doing this work, when we founded the Office of Environmental Justice, we had about $3 to $4 million for the entire country. Now we literally have, $100 billion to make a dent in the work that needs to happen. And then you have the J4 principles, which actually gives you sort of a framework from which to operate in for those who are maybe newer to the environmental justice space. And there's a tool that maybe some of you have taken a peek at called CJEST. It is a tool that came out of the environmental justice screening tool, and then the White House lifted this to the next level. So it is a climate and economic justice screening tool. Think of it as a GIS tool where you could plug in your zip code, your lat longs, and then you have a suite of different databases that you can pull information from, and it'll give you a map that shows the various things that are going on in a particular location. So it helps as folks are trying to make some decisions about where they might want to work. It helps when folks are trying to have a better understanding of the areas that have been disinvested in. And it also helps to be able to tie work that has happened and show best practices. So it's a really great tool, has a lot of different data that's in there. It continues to evolve and grow. There's healthcare data, there's housing data, there's transportation data, there's environmental data, and I believe there's some agricultural data that's in there now as well. So it's a great tool if you're trying to maybe figure out you're seeing something pop up in a way that hasn't traditionally been. Maybe it's asthma cases, or maybe it's another set of impacts. By taking a look at the tool, it may be able to give you some better understanding of some of the things. You'll be able to have a better understanding of also, as Baldwin said, some of the things that you can't see. Often there will be a facility or a set of facilities that maybe you didn't even know was in the area. And it might help to guide you as you're thinking through and having conversations with folks. These are some of the other investments that have happened. It's grown a bit more also since this particular slide was put in place. And there's another set of resources that the federal government is going to be moving out over the next month or so to continue to build the capacity for addressing environmental injustices. So as you can see there are resources around electric vehicles, and often whether we're talking about buses, which are incredibly important inside of our communities to lower the air pollution impacts, those tailpipe emissions, or if you're talking about the things that are happening at our ports, so the work that's happening around zero emissions around ships, transportation issues in relationship to trains, all these various types of things. There's now some resources to be able to move forward. And in many instances, that's critically important for our communities because there was, transportation injustice for years. People built roads to bring pollution into certain communities and wealth into others. The things that are going on around housing justice and people building and being pushed into areas where they were building in floodplains and a number of other types of things. So we finally have an opportunity to begin to address, as my grandmother would say, the sins of the past, and be able to move forward. The other one that I wanted to bring forward real quickly is the CHIPS and Science Act. It's important because often our communities are not thought, right away when we start talking about some of the technology that's going to be necessary for us to be able to move forward and to address some of the injustices. So when I'm having conversations with folks, I'm reminding them that when we talk about this new clean economy, when we talk about the new sets of opportunities that are there in technology, that we're also talking about the opportunities for you not just to be a worker in that space and not just for it to also address some of the public health impacts, but there's also an opportunity for you to be an owner in that space and to explore the entrepreneurialism aspect of creating your own businesses so that we can also address the wealth gap that exists inside of our community. So we talk a little bit about that. And these are some just the amazing younger folks of color who are creating their own businesses in that space. And what I love about it is that they went to HBCUs for those who were blessed with that opportunity. And then just talking a little bit about some of the new business opportunities that are there. And you'll just see there's just a significant amount of money that's finally on the table for us to address some things, whether it's talking about lead hazard reductions, rebuilding of our communities, making sure the right types of infrastructure is there, green infrastructure that's built for the 21st century. And then I wanted to just bring in, it's not just federal dollars that are out there. There are a number of foundations and individuals who are also making significant contributions. And in many instances, some of the folks who are here on the screen, who hopefully will be finding opportunities to partner with frontline organizations or other entities that are trying their best to be of assistance. Some of the resources may come from some of these foundations and individuals who are making change. I had to bring our sister Rihanna into it because she is making sure that she is making significant investments along with a number of others. And I wanted to bring this into our conversation. I'm not sure how many of you know about the Climate and Health Foundation. They're doing a lot of amazing work around climate medicine and helping MDs to be able to get educated, to get them plugged in. They're creating fellowship opportunities, especially for newer docs, to really have an opportunity to get hands-on experience. They're creating curricula, content. They're doing a number of things. And because this year at COP28 in Dubai, which is coming up in about 3 weeks now, for the first time, COP is now placing a significant focus on public health. So they have built a lot of content that will be shared there as well. So there is a number of docs who will be going over sharing their research, sharing best practices, and sharing also how they're authentically engaging with frontline communities. If you need any introductions, I do a lot of work with them, or you have an interest in getting plugged into what's happening at COP, let me know. I wanted to give you a real world example of how real change happens also, because we often talk from a theoretical position instead of just bringing it down to the grassroots, if I can say it that way. If you get a chance, take a look at this project. It's the Regenesis Project. It's in Spartanburg, South Carolina. Harold Mitchell and a number of other folks run the initiative there. They got a $20,000 environmental justice small grant, a program that the last administration tried to eliminate. And they utilized those dollars and leveraged over $300 million in changes. Like they had old shotgun housing in the community before. For those of you who know what shotgun housing is, you open up the front door, you can see out the back door. Very little insulation in the home. Folks were paying $300 to $400 a month for their electricity costs. We got 500 new green homes built, and now folks are paying $67 a month. And they've also had brownfields and Superfund sites that were cleaned up. Putting a new 35-acre solar farm, which will zero out people's electricity costs. They have worker training programs where people have started to build their own businesses now and actually help to rebuild the community. They had lack of access to healthcare. Seniors had to travel 20, 30 minutes to be able to get to healthcare. Now they've got 5 new healthcare centers in the area. They have a mobile healthcare unit also that goes out to schools. They have a dental mobile unit as well. So they're really making sure that people have access and affordability to the healthcare that's there. And they've done a number of other things. They had bad transportation routes, and they had a chemical plant that if it exploded, of course, people would have had some real challenging situations. So take a look if you have a moment. If I had more time, I would go into more examples from this particular story, but there are a number of stories of how communities are moving from surviving to thriving, how they are revitalizing their community, which is important as we're thinking through this. This is the old shotgun housing I mentioned there. These are the new green homes, and they have a process also so that to make sure that folks are able to move from being renters to homeowners. And we all know how powerful that can be when we make sure that it happens. And then these are just some photos of the solar stuff. We have the Clean Economy of Color Coalition, which brings together, as the name says, folks of color to help educate folks on where the sets of opportunities are, link them up with folks who've been working in the space for a while, and once again, bringing forward those promising practices or best practices so folks can see themselves reflected in how change can and does happen. And I wanted to bring in Ms. Donnell Wilkins from Detroit. She has the Green Door Initiative. And then, of course, the other one is Detroiters Working for Environmental Justice. They have one of the highest rates of retention for their worker training programs. So they have two sets of folks that they primarily focus on. One is young people. The other one is returning citizens, and making sure that they have new skill sets so that they can thrive in the developing economy, if you will, and to also bring hope back to their communities. So my grandmother says you have power unless you give it away. Our power plays out in lots of different ways. The Women's March is a great example of a whole bunch of men saying 1 million women would never get together, and sisters said, oh yeah, I got something for you. And not only did folks march, but they actually went back home and they said, if I can't find somebody who will represent me, whether in county governments or local governments or state governments or on Capitol Hill, I'll run for office myself. And you see all these amazing women who are now helping to ensure that we have a more equitable society, a safer society. And that comes out of not just marching and gathering, but actually realizing you have power. Science March, which I was a part of, was incredible. But in many instances, scientists were not necessarily connected to what's going on in our most vulnerable communities. And we were able to change that dynamic where scientists were coming out of their labs and now actually connecting with frontline organizations, helping people to understand, sometimes very technical information so that communities can make the best decisions for themselves. And then, of course, young people, well, no matter what social movement we've had, throughout the time in this country, young people have played a critical role. So whether it is, the young people with the Green New Deal over the Sunrise Movement advocating for that, or This Is 0 Hour, or the HBCU Climate Change Initiative, there are just all these amazing young people who are getting engaged and saying that we can and will have a better day. Don't pay any attention to that guy in the middle, but everybody hopefully knows that Senator Booker is an amazing champion, not only for environmental justice and climate issues and healthcare issues, but a number of other pressing needs that we have inside of our communities. And we worked on the Environmental Justice for All Act, which hopefully we will be able to get passed sometime here soon. And then, of course, my time at the Hip Hop Caucus, change is not going to happen unless people vote, making sure that we are educating, especially folks who have often felt that their vote didn't matter. So all the work that we've done here is for those babies that you see there on the right-hand side and other babies, and making sure that they are going to have a more sustainable planet and a healthier planet. So we're very thankful for that. I know I'm running short on time, so I'll just share with you words of Dr. King when he said that we come to these shores in different ships, but we're all in the same boat now. When you think about the impacts that are happening from the climate crisis, it is literally impacting all of us. Some of us get hit first and worst, but everyone will have to deal with the challenges that are in that space. And same thing with environmental injustice. Pollution moves, and it has impacts on folks. So we have a moment to actually make real change happen. So with that being said, I know that I am a little long, and I want to slow down and turn the mic back over to our moderator.
Thank you so much, Dr. Ali, for a great and enlightening presentation. I do want to get in a couple of the questions that have come in the chat. I'm going to combine two of them. What are your thoughts on the best mechanism to ensure the funds flow the way Justice 40 prescribes? You know, HBCU alum was suggested here. And also, are there tools that you would suggest for use in global communities?
Mm-hmm. So for the first question, you know, we have to make sure, one, that we have strong coalitions, and those coalitions are pushing on the state level to have those governors actually make sure that the resources make it to the spaces and places that need them the most. When we find that folks are not doing that, of course, you have tools like Title VI of the Civil Rights Act. We have a Department of Justice that is very active when they see folks not honoring the letter of the law. So one, it is really about mobilizing and strategizing and helping people to understand that these resources are coming from your taxes. You have the same right as anyone else to be advocating for them to go. And then, of course, in working with community, making sure that communities' voices are being honored and that communities are saying, these are the things that we're looking for, and then making sure that we are pushing in the right direction to honor what those requests are. What was the second question?
The second question was global communities. What tools can we utilize for global communities?
The Office of Environmental Justice has a number of tools that have been developed over the years. There's the model plan for public participation. There's a number of others on how to properly engage. So that's one set of tools. I would also say that you should reach out to leaders in the environmental justice and climate justice space, because we have been doing work internationally for years and building bridges. So there are some relationships that already exist there, and there are already sets of ideas of how to do it in an authentic way. So I always bring it back to the front lines. And, you know, with you all partnering in those spaces, you know, it's an incredible combination to make sure that that happens. The other part, of course, is these various sets of meetings that happen around COP. So it's not just the thing that you see getting ready to happen in Dubai. There are sets of engagements on the international level around treaties and a number of other things. So for those who are wonky and enjoy being in that space, that's another space that gives us an opportunity. And hit me up offline, because I know we're short on time. I can give you about 8 or 9 other things that we can do.
Oh, great. Well, yes, this discussion really can go on much longer, but we have to wrap up. And we really want to thank Dr. Ali for your time and your expertise and participating in this webinar series. I hope you all, as our audience, found it useful. This is the last of our webinar series for this year, and we will restart in the new year. Before you leave, please take a moment to complete the webinar survey if you haven't already. The link is in the chat. And the PowerPoint that you see, the PowerPoint slide that you see on the screen is how you can claim your CME. Again, the code for today is 13104. This now concludes our session. Have a wonderful day.